guys, this is Charity Stanley, and today we're talking about person-centered therapy. Person-centered therapy is going to be a counseling modality that we can use that focuses on the person and focuses on the person's hopes and dreams, and it's a very unique approach to be able to utilize our therapeutic time in therapy to be able to make greatest advancements for the person who is in therapy. So one of the keys of person-centered therapy, I like to think of it as being illustrated by this quote. So with person-centered therapy, the way to get going in person-centered therapy is to quit talking and start doing. So this is a quote from Walt Disney. Person-centered therapy, or the components of, have been shown to be effective in treating depression, anxiety, post-traumatic stress disorder, and other mental illnesses. This approach is very unique, and people who have strong soft people skills, like being able to communicate effectively and efficiently with clients, are likely to be able to use this approach with very minimal formal psychological training. Person-centered therapy, what is it? Why would we want to use this theoretical approach? Person-centered therapy is a unique approach where the therapist takes the back seat and allows the client to direct the therapy process. The goals of person-centered therapy are to help facilitate and decrease negative self-perceptions that will facilitate self-actualization. The way that person-centered therapy is non-directive in nature can be a critique of this approach as well. Some clients want to have a therapist engage in a more interactive, guiding approach with therapy. Finally, today we are talking about ways to integrate the person-centered approach within our future personal therapy approaches and different ways, therapeutic techniques we can use with patients. Person-centered therapy was initially used by Carl Rogers in the 1940s. At this time, the psychoanalytic theory was the prevailing psychological approach. Carl Rogers believed that people are the experts on themselves and they have all the answers to their own problems if they're given the right guidance. In person-centered therapy, the therapist takes a non-directive role and the client directs the direction of therapy and topics of therapy. The role of the therapist is to provide a safe space that's conducive to uncensored patient self-exploration. The therapist reflects the patient's speech, allowing the client to obtain insights about their condition and the ways in which they can improve their issues and situations. Components of person-centered therapy are frequently integrated into modern therapeutic environments when combined with other theories. Many therapists use an eclectic approach when using theoretical paradigms within therapy and pick and choose certain techniques from different therapies. So person-centered therapy focuses on the therapist engaging in reflective listening, and this allows the therapist to have a non-judgmental environment to allow the client space for self-exploration. The paraphrasing of the client's language by the therapist allows processing of the emotional content in a different way, facilitating the client's self-analysis. When the client has all the answers that are needed within themselves, it is a matter of allowing the client a safe space to open up and accept the client and allow them to find the potential solutions for their problems. Improving the client's self-esteem and belief of competence in their decision-making is facilitated through unconditional positive regard. By allowing the client to discover the possibilities and the answers within themselves, they improve recognition of having an internal locus of control. Through therapist-directed solutions, the client only focuses on finding solutions externally through another person. The goals of therapy are recognition of a client's feelings and thoughts. This decreases anxiety and achieves self-actualization. The congruence of the therapist and the unconditional positive regard of the therapist benefits the client by promoting honest self-exploration. A client's self-efficacy and self-esteem are improved by utilizing this client-driven therapeutic context. The session content and direction are completely client-driven, not therapist-driven. How to implement person-centered therapy within your personal practice. The therapist needs to genuinely like people and take an interest in them. With person-centered therapy, the keys are reflective listening, accurate empathy, congruence, and unconditional positive regard for the patient. We've already talked about reflective listening. Accurate empathy is paying careful attention to the client's thoughts and feelings. The therapist accepts the client's world as it is presented without question. Therapist congruence is important due to people being able to see if a person is being fake or superficial. Clients need to believe in the unconditional positive regard, and it is not something that's easily faked. What is unconditional positive regard? It is the environment in which the therapist does not judge the client or their decisions. They don't approve or disapprove of the client or the client's decisions. This allows the client to engage in deeper self-exploration and promotes the development of the client's insight. Some criticisms of the person-centered approach to therapy is that it is a vague approach. It can take a long time for patients to benefit from therapy. There's a lack of controlled research on person-centered therapy. Due to the nature of person-centered therapy, controls cannot be established because the client is directing the sessions and the content of the therapy sessions. Objective data is difficult to obtain for research purposes as well. Some clinicians believe that person-centered therapy, that the benefits are not due to the approach, but to the genuine nature of the therapist. The success from the therapist having good communication skills, unconditional positive regard for patients, congruence, and an ability to connect with the patient on a deeper level. Finally, some clients are too mentally ill to be able to reap the benefits from an uncontrolled, undirected therapeutic environment. Here are the resources and references that I used for this presentation, and thank you very much for listening.